City Vibes Metro. I'm your host, Christina Andrianopoulos. Thank you very much for your feedback and support in watching my show. Today's episode is dedicated to a very good friend of mine, Dawn Theoritis, who recently passed away. Dawn, we love you, and we send our thoughts and prayers to your lovely wife, Lisa T., and your children and family. Our hearts go out to you for the loss of a great man. Donnie will miss you. In my health and fitness segment, I have the great pleasure to bring back by popular demand Dr. Stuart Bentkover, a renowned facial plastic surgeon who will give us the vital facts on facial fillers and neuromodulators. He will talk about the various products on the market and how they should be used to enhance your appearance, making you look refreshed and more youthful. Welcome back. I have the great pleasure to introduce, by popular demand, Dr. Stuart Bentkover. Hi, Dr. Bentkover.
How are you? Good to be back.
Nice to see you. I know that there's so much information about various products in the market in reference to fillers that enhance your appearance. And you know what? I also wanted to say that Oprah Winfrey has her Dr. Oz, and I have my Dr. Bentkover.
Well, thank you. Thank you.
So why don't we talk about the various products, because there's so much information about it. So go right into it.
Basically, the facial fillers break down into three large categories. The most common facial fillers are the hyaluronic acids, Juvederm, Perlane, Restylane, and then there's a product called Radiesse, which is what's called calcium hydroxylapatite. It's calcium and phosphate injected under the skin. And then some of the newer ones to the market are Evolence and Artifil and poly-L-lactic acid called Sculptra. Actually, the way that a doctor decides which filler to use is based on his or her own experience and longevity and the patient's own desires. Pretty much the fillers do about the same. Some are better in certain locations than others. I think we can probably go to some of the slides and we can illustrate that.
Before we do that, I just wanted to ask you something that I heard that some of them use your natural collagen to reproduce. Does that
Absolutely
really
true.
happen?
It's pretty well documented that Radiesse, which is calcium and phosphate, will stimulate your own collagen. So the Radiesse is injected. It has what's called a carrier gel. The gel goes away over about 8 or 10 weeks and gets replaced with your own collagen. It's well documented on biopsies, actually, that your collagen grows and plumps it up. And if you keep up with the Radiesse, you'll keep that collagen underneath the skin at the layer of what's called the dermis. You'll keep that intact. The hyaluronic acids do that less. Sculptra does it, but Sculptra is a more involved process. It involves the patient massaging their face, and I know surgeons who like it. I just don't like it because it's just not as controllable. Sometimes you get lumps.
Okay, now let's go to the slides.
Sure.
Okay. The first one's the Radiesse, right?
This is a young lady who's was 48 years old when we did this. She's a regular patient now.
And now she's 29.
Yeah, now she's 29. We put Radiesse into what's called the cheek lip groove between the cheek and the upper lip, and into the marionette area down in front of the jowl. And it does a very, very nice job. The difference between using Radiesse and a product, a hyaluronic acid like Juvederm in this area, is that you need to use about twice as much hyaluronic acid as you do the Radiesse. Also, in pretty good clinical studies, it showed that patients thought that Radiesse looks more natural than the hyaluronic acid. So we tend to use Radiesse in this area.
Okay, let's go back to Dr. Bentkover. So what you do is you inject it right into the skin, and
Just
usually
right,
the marionette. Describe what the marionette.
Well, the marionette area is here,
right,
sort of in front of the jowl. The cheek lip groove, or what's technically called the melolabial crease, what people commonly call on the internet the nasolabial crease, is right here. This actually isn't the nasolabial crease. The nasolabial crease is up here, but this is what they talk about, the nasolabials, or what the Juvederm people call the parentheses. Juvederm is injected into the skin, into the deep layer of the dermis. Radiesse is injected under the skin, just underneath the dermis. So the effect is a little different. Sometimes the people with really deep creases will inject Radiesse deep and then Juvederm on top.
I see.
But in most cases here, we usually prefer Radiesse.
Let's go to the second slide, because this is unbelievable to watch, what little you can do. Okay, so
this is our
Juvederm.
preferred place for Juvederm, which is lip augmentation. And this is a young patient we've seen it last up to a year. Now, all these products go away slowly, and while we'll say, for example, Radiesse and the cheek lip grooves may last 10 to 14 months, you really should be coming in at about 8 months to see if you need a top off.
But you know, there's some women, see those lips on the right?
Yeah.
There's some women who do it so much, they look like Barbie dolls. But let's go back to Dr. Bentkover as we chat with you about this.
Some women want to look like Barbie dolls.
They want to look like Barbie dolls? You know, they have these plump lips, and I think
you
it's
have
overdone.
to choose. You have to choose. It's one of the most difficult issues we have with fillers is when we're doing lips, will it be enough? And the young ladies in their late 20s and early 30s more commonly come back and say, I want more.
It sounds like another part of the body they want more. But
Yeah,
let's go
yes.
to the next slide. Well, we won't get into that
But
because
yes,
you don't
but
do
we
that
can.
surgery.
But this is easier to put more in than the other part of the body.
Perlane.
This is Perlane, and we place this in the marionette creases right in front of the jowl. Perlane is very similar to Juvederm. They're both hyaluronic acids in about the same concentration. It's just the production process is a little different. The Juvederm flows a little better. You get a little more, in my experience, a little more bruising with Perlane.
But that's amazing. Look at the slide and left. She's a gorgeous, beautiful woman, and just that little bit of change, what it does, it just
right in front of the jowl. Yeah.
Yeah. All right, let's go back to
She's
Dr. Bentkover.
48.
But in the next slide on the right, she looked like she was 39, like we all do. All right, and then we have one more, because I was going to ask you, do men do this too?
Yes, men do it less consistently. Men don't come for fillers as much. They will come for Botox. The issue is whether men sort of keep it up.
And they don't want anybody to know.
Yes, well, nobody wants anybody to know, but the neuromodulators on the market in the United States are Botox and the newer product called Dysport. Dysport has been in competition with Botox in Europe for about 19 years, so it's a well-established product. It was supposed to come out under the name Relaxin, but the FDA made them keep the same name. They basically work about the same way. The major issue, as we can see right now, is that while some people can develop an immunity to Botox, it seems that you cannot develop an immunity to Dysport. So that's the major difference.
Oh, that's great. Okay, let's look at that. Okay, so this is a man.
Placed in the crow's feet. And if you look very carefully, look at the wrinkling under the eye, actually. That's caused by the muscle thickening up, we call
Amazing.
it. And the Botox or the Dysport will relax that muscle.
Okay, let's go back to Dr. Bentkover because we have about 30 seconds. So you're located right in Med Center.
Yeah, Worcester Medical Center on the 6th floor.
On the 6th floor, and you also have other locations.
One in Stoneham, which is just north of Boston, on Montvale Avenue.
And then you do consult first, so people can just call you. And as you're speaking, it's popping up. And you'll consult with them and sort of just work with whatever their lifestyle needs are. Make an appointment for
consultation, see what I think will fit, see what fits into their lifestyle. I mean, the one issue you need to watch with fillers is that fillers will not replace surgery when you really need surgery. Right? If you really need a facelift, if you really need a mini lift, if you really need a neck lift, no amount of filler is going to replace that. We see patients come in who say, well, I had filler here and it didn't work. Well, what the person was trying to do was to fill enough in here to try to hide a jowl that really needs to be tucked, so that you have to be
But initially we don't have to look like puppets, and we don't have that little V in between the eyes because of
there is definitely a place for fillers, and
thank
you, and neuromodulators. Thank you. I'm happy to be your Dr. Oz.
Thank you. All right. Well, thanks, Dr. Bentkover.
Thank you very much. Good
and we'll be right back.
The Hanover Theater for the Performing Arts presents the 2009-2010 Broadway series. The Wizard of Oz, Legally Blonde, A Chorus Line, Riverdance, Beauty and the Beast, Cirque Dreams Illumination, A Christmas Carol.
5, 6, 7, 8!
Experience the new Worcester at the Hanover Theater.
Bentkover's Facial Plastic Surgery and Laser Center. Enhance your appearance, renew your face, rejuvenate your skin. Personal, confidential cosmetic treatments and surgery that will revitalize your life. Whether you want to look less tired and refreshed or a complete makeover, our practice will help you achieve your aesthetic goal. Our patients include top executives, men and women, and celebrities. Shh, totally confidential. We won't tell.